That smell, unless you've got it, you don't realise.
Malodour is definitely one of the symptoms that patients report to us, along with pain and the exudate levels. But sometimes I feel as though we bunch it together as a group of symptoms without looking at them individually. The different symptoms affect people differently. Malodour isn't just specifically to one age group. I would say it's all across the board. I would say the majority of the malodorous wounds that we see are chronic leg ulcers.
My name's Chantal. I'm from Leeds. I suffer with mobility issues, chronic leg ulcers, which is, yeah, it's been a real roller coaster for me. My wound broke out in 2009. I was only like in my early mid, about 34, 35 it would have been or something. Well, the pain's the worst thing about it, but I mean, obviously as well, like the smell, because it's embarrassing as well. Unless you've got it, you don't realise. Probably would smell more if it was had an infection or something, and when it's got the green in it, all that badness and all that exudate and that. Because don't forget, my leg was like leaking at the same time as well, obviously because it was not well. It was just awful. Yeah, yeah. I mean, walking around like that.
My name's Bob. I care for my wife. Her name's Lynn. She's got a multitude of medical conditions at the moment, but very challenging, as you can imagine. When the wound was the early stages, it wasn't a big issue. Unfortunately, they deteriorated rapidly, and then the odours accordingly went from bad to worse to being not particularly pleasant at all.
We talk about pain often, but we don't often address how they feel about the odour of the wound. They don't often use the word odour. They may use the word like, it's smelly nice.
You can like take the smell for a baby's nappy or advent, and it'd be actually my leg.
Easiest way to describe it, rotten flesh, which doesn't smell particularly pleasant. And I knew we had some serious issues.
Patients definitely tell us that it stops them doing things that they would normally do, normal activities. We have a young lady who was embarrassed about going to work.
I wouldn't have gone and sat in a restaurant with it or something because I'd have thought, oh God, it's going to smell, When I was working at the school as well, a little pupil, and he was a good kiddie, but you know what I mean, wasn't rude about anything or all, it was just, Miss Angie, you like, kids, like, you like smells. I said, okay, it's okay, thank you. Yeah. It made me feel so small and embarrassed. I just thought I can't cope with this.
We have a patient actually that sleeps in a different room to her husband because she's very conscious about the smell and she doesn't want her husband to smell the wound.
It's in my living room and it's like on the shelf, like a thing, what, you know, them sensor spray things, what go off it. I've even sprayed that on it, believe it or not. I don't care, and even when it don't smell, like I say, I still go to spray it. I mean, like I said, I put perfume on it earlier. My best perfume. Sprayed on it, you know. I could have got some off at doctor, but it wouldn't have been much different to air freshener, we said. So I actually did get one can of something, and then that was the last time, and I've just like, and if it has been smelly, or even before it's got smelly, just have a little spray down there just in case. Yeah, it'd have to be strong because of the smell, because it'd just come back anyway. I have to change my quilt cover set probably 3 times a week or something, 4 times a week, and then that's washing, then that's drying.
Where odours are concerned, you're doing extra washing, which has got a financial impact. Windows open more to try and alleviate the odour. Subsequently, you're putting central heating on to try and get a balanced combat. You can't have a patient who's struggling enough. You don't want a cold patient on top of that.
It's just a case of, basically, I had to put up with it, didn't I? You know, or, yeah, if it were that bad, I probably could have rung a nurse there, can I have, you know, because they knew, obviously, what I was going through. I thought sometimes, what's the point in, like, going on in life, being serious, because I'm thinking, well, what can I really do? It don't make you look attractive, you know, I've had it most of my 30s anyway. It's just wasted my life. Well, yeah, it has. Apart from my children and my granddaughter, I just think it's just wasted my time, really.
I think Lynn were pretty similar to me, actually, because, excuse me, she's an incredibly positive person, I would say. I think we just accepted it, you know. It's one of them issues where, yeah, you know, it's there. It's it needs addressing. We were doing our best, and you know, both from a physical and a mental point of view, it didn't really. We didn't let it get us. We didn't let it get us down. We just accepted it.
I think we try and protect the patients, so we might say something like, oh, don't worry, it's not too bad, when actually it is, and I'll have documented that it's very offensive smelling, and yet I'm not really projecting that to the patient or exploring it and maybe what we could do about it and their feelings.
I haven't had much training around fungating wounds or, you know, big deep wounds, but I've shadowed lots of people who I've gained a lot of experience and knowledge from and asked lots of questions.
We think odour means that something's happening in the wound, but it doesn't always mean that there's an infection going on. I think what strikes me most is that it's just a little tick box. When we do our assessments, it'll say odour, and we'll just document what level of odour it is, whether it's when we enter the room, when we remove the dressings, or whether there's no odour. Another challenge of addressing the malodour is what we do as the nurse to address it. So the things that we can do, for example, are to dress the wound more frequently. but there's a massive time element involved with that. My instinct is to say, this wound's malodorous, let's change it more frequently. Let's do it every other day instead of every fourth day. But we're a really busy caseload, and that has an impact not only on the financial aspect of redressing the wound, but the time constraint for us and for the patient. You know, they may go shopping on a Tuesday, or they may go to a little group, and we're impacting on that because we don't often say what time we're going, so they may waiting for that whole day.
We had a nurse what used to come, no disrespect to them, but due to the demand on nurses, it was a bit hit and miss. And I suggested one day, I said, why don't you show me and train me how to do the wounds, and I can do it, which obviously, you know, were suited both parties. We were doing it on a daily basis initially, but then what we decided to do, I was doing it twice a day to try and get on back, because it smelled unpleasant, and we were getting a lot of residue, and dressings were, you know, couldn't cope with it, so we had to do it twice a day to try and keep on top of things.
If the nurses weren't due, I'd just like take it off and then probably do it myself, and it wasn't done right, obviously, which is dangerous, which I already know about, but it just needed changing, you know, because sometimes I thought, okay, I'm just leaving it, put the spray on it and what have you.
As a leading company specialising in high exudate wound care, we understand that wound odour is a significant yet often unaddressed challenge for both clinicians and patients. We listened, and we innovated, introducing Sea-Sorb Carbon, the next evolution in wound management, a two-in-one solution designed to tackle both high exudate and wound odour. Sea-Sorb Carbon features an advanced multi-layer design, with each layer working together for optimal absorption, comfort and protection. A soft contact layer that minimises pain during application and removal. Dual dispersion layers for fast and even fluid absorption. A super absorbent gelling core that locks away exudate and bacteria. An activated charcoal layer to neutralise odour. And a fluid repellent layer to prevent strike-through and maintain a clean, comfortable environment. Sea-Sorb Carbon is designed for versatile application, adapting to different patient needs. It's effective under compression garments, retaining large volumes of fluid without any leakage. It can easily be applied with medical tape for a quick, secure fit, or it can also be secured with a standard bandage, offering flexibility for a range of indications in a variety of clinical settings. Beyond its high absorbency and retention capabilities, Sea-Sorb Carbon reduces dressing changes to save valuable nursing time. It's a cost-effective solution that can be used both as a primary and secondary dressing, enabling clinicians to deliver optimal care while enhancing patient comfort.
We need to do more research about malodor of wounds. We do research about exudate levels, about infection, about static wounds, but we need to do more research about malodor, how it affects the patients, how it affects the wound healing, and the impact on our time and our finances.
Well, if I could change anything, it would be to have them just educated a bit about it, you know, just to let them know, well, this smell, and then this smell is affecting so-and-so like this, and just give a bit of empathy and that.
I'm not a nurse. I'm good at doing what I do because I'm committed and dedicated to doing, obviously, my best job in difficult circumstances.